Welcome to our Strengthening Families monthly webinar. Today we'll be talking about legal problem solving with families. And we'll just give you a little background on the webinars and when they happen. So these webinars are an open invitation to all of those who use the Protective Factors framework and are coordinating strengthening families efforts across the country. We do these webinars jointly with CSSB, the Center for the Study of Social Policy, and the Children's Trust Fund Alliance. The topics and the guest speakers are coordinated by us, and so we are always looking for suggestions and volunteers, so please contact Kaylin or myself. And the recordings and materials from past webinars, where the information from today are actually archived on the Children's Trust Fund Alliance, and we will put that link in for you so that you can see the umpteen million past webinars that we've done and the topics and the materials that go along with those. Upcoming webinars.
Maureen,
yes.
we're not seeing your slides advance. Is it possible that you paused?
It is possible somehow that something wacky is happening. Okay, is that better?
There we go. Yep.
Perfect. Okay. Excellent. So this is about the webinars. We're going to put that link in for you. And then upcoming webinars. So these happen on the second Thursday of each month, 3 o'clock Eastern time. And in February, our upcoming topic is advancing early relational health and emotional connection. Kaylin has some more information on that towards the end of today for updates, but this is going to be new materials that are coming out. And then for our, wow, it seems like the year's advancing already, right? March, April, May, these topics will be announced and we'll be there before you know it. So you can subscribe to CSSB's Strengthening Families newsletter to get the webinar invitations. And so we will put that link in the chat box for you. And then today's agenda. So legal problem solving with families. Samantha Morton is with us, and she's a consultant to MLPB. Updates from the Alliance I will give you at the end of Samantha's presentation, and then updates from Kaylin O'Connor from CSSB. So welcome to all of you, and Happy New Year. So let's get started.
Thank you so much, Maureen. I'm going to introduce Samantha while she switches over to sharing her screen. Samantha Morton is the previous director of the MLPB, Medical Legal Partnership of Boston, and has been a partner in our Dulce work. And I'm sure she's going to share a wealth of information that will make it clear just how engaged in this work she is and has been. She's now a consultant to MLPB and continuing great work around these issues. So we're going to hand over to Samantha to talk about legal problem solving with families.
Thank you so much, Kaylin and colleagues at CSSB and in the Strengthening Families family. It's a pleasure to be here after 20 years of working in the medical legal partnership community. I am now in a different phase of my career doing some consulting, but one of my delights today, before I dive into our topic at hand, is to make sure that I get a chance to introduce MLPB's new CEO, Amy Copperman, who is here on today's Zoom webinar. I wonder, Amy, are you unmute and just say a quick hello?
Thank you for letting me. Hi. I don't think I can put on my video either, but just wanted to say hi. I'm really excited to be here. This is day 4 for me, so everything is new for me. And I'm just happy to be here and share space. And I'm just so deeply appreciative for Samantha's leadership on this project and at MLPB. And I'm just looking forward to more conversations about this with lots of people in this space. So thank you.
Well, thank you, Amy. I'm really excited for everyone here to get to know you and MLPB's next chapter and vice versa, because in our experience, these are the people who put human in humanity. And on that note, just picking up where Amy left off, because we're in a webinar format, which has a lot of pros, one con is that I, as your facilitator, can't see you. I can hear you, I can see the chat, but I'm going to ask you to please, bring your most human chemical energy to the chat today, because we're talking on the East Coast at 3 o'clock on a Thursday, and I don't know about anybody else, but sometimes I have to bring a little extra oomph at that time. And I'm counting on all of you to bring that oomph. We're going to do some interactive stuff, and we're going to do it in the chat as opposed to a poll. In any event, thanks again for having me, and thank you for what you all do every day to put the human in the idea of humanity. So what are we talking about today? We're talking about flourishing and what role legal problem solving has in flourishing. Now, you've already been invited by our hosts to put who you are, in the most traditional way in the chat. I'm curious what your favorite flower or plant is, because we're going to be talking about flourishing. And in many ways, the work that all of you do every day is tending a garden where many seeds are planted, and some grow and flourish, and some unfortunately don't. And there's a lot to think about when we think about the role of a range of problem-solving strategies in flourishing, especially for the youngest members of our society. Thank you so much for these shares, everyone. I'm loving seeing the daisies, the lilacs, black-eyed Susans, a ZZ plant. I have to look at that one, Amy. Oh boy, sunflowers. They're like the tall night of flowers, aren't they? In any event, just keep that flourishing idea in your mind as we're talking today, because it's really on us in our culture to connect these dots between people's rights and families' goals and needs and flourishing, because it's not easy for everybody to see those connections, but everybody here does, I'm confident. So a few quick introductions beyond myself and Amy. We are part of an organization known as MLPB, which does something a little bit different than other medical legal partnerships that you might be familiar with. While we started by providing legal representation services to patients, to families, and I carried a pager 20 years ago responding to acute legal needs in court that pediatricians wanted their patients to get help with, which remains a revolutionary innovation. We really have focused on how to, we have shifted focus to really think about how you, the main problem-solving partners, the problem-solving partners in many families' lives who have generated the most trust with those families, can be supported to engage in impactful, role-aligned legal problem solving. And so historically, we have this lovely history with the MLP movement, and actually started as part of a large safety net hospital here in New England. And we've evolved to take a very broad view on which organizations and sectors produce and sustain health. And that's part of how we got to know CSSP and so many wonderful early childhood colleagues through Dual Say and other initiatives. And we're also really interested in the same way that I think everyone on this call is in prevention. How do we concretely, operationally shift from crisis management to prevention? And we do a few different things internally in our partnerships to get there. Just doing the song and dance that's obliged about introducing any organization that may be new to you, but please know, very happy to get to know all of you, and for you to get to know us, mlpb.health. So concrete supports. What's law and policy got to do with it? And yes, did anyone see Angela Bassett win for Wakanda Forever on the awards the other night? I can't forget her amazing Tina performance when I introduce this next section. So let's talk for a moment, and let's bring what I know is your deep expertise and human energy at 3 o'clock or noon on a Thursday to this. So please, let's talk in the chat. Mirna is a solo parent. She has a daughter with sickle cell disease. She came to the US from the DR without papers. She works several jobs and taps friends and family for childcare, which can be both stressful and unpredictable. She's staying with her brother's family right now, and it's not always comfortable. Sometimes it's awkward. She'd like to have her own place, but when she searches, landlords all say things like, oh, it's already rented, or I decided to sell. So tell us, what barriers do you see potentially in Mirna's life to accessing concrete supports? I know you might see a few here. Thank you, Maureen. Racism, Jen and Tanisha. No papers in our country means unlawful, undocumented immigration status, which is a huge barrier to accessing a range of health promoting benefits and services. I see discrimination, which may tie to racism. Yeah, does Mirna understand her rights? Thank you, Julie. And even if she knows what her rights are, is she comfortable pursuing them? Because there could be some unintended consequences. And thank you, Fabiola. Very important language access barriers, potentially. We don't know in the way the hypothetical is written. So does the reference to all the landlords saying it's already rented or I decided to sell make anyone think that there's been a fair housing violation? That's a kind of fancy word that the legal community uses to say, you know what, it's unlawful to discriminate based on a tenant because of their race, because of their family status, because of a lot of different things. Let's go to the next phase with Mirna. She's got an apartment now. She notices that the windows are so drafty that the unit is always cold, and she can't afford to run the heat high all the time. Understood. This conversation doesn't go well with her landlord. He calls her a troublemaker and says if she brings it up again, he will call ICE and have her deported. As if this isn't enough, she also got a notice that her child, who happens to be a citizen, that the SNAP benefits for that child are being terminated. This means that her budget next month won't add up. What do you see here in terms of new barriers, new obstacles, and possibly ways to overcome those obstacles? In the last example, in the last part of the hypothetical, we know that, there might be a fair housing violation here, race or family status-based discrimination against Mirna and her daughter. And that might produce, some pathways to solutions. And I wonder what you see here. Is there a word that that comes to mind when a landlord makes a threat like this? Yeah, threats. Oh my goodness, yes, Leslie. Retribution, eviction, it's unsafe. And again, because in our country, the language of the law is a big part of how the law is navigated. And we'll talk another day about how exclusionary the language of the law is. The legal word for what this landlord is doing is retaliation. And in almost every state in the union, I haven't done the 50-state survey recently, it's illegal. And it's awful, really awful. Extortion, Jen, interesting idea. Extortion. I don't know if it meets the legal definition, but I'll tell you, I really agree with you on a moral basis. So there may be, again, other fair housing and non-discrimination protections for Mirna and her daughter, especially if this landlord pursues an eviction case against them, tries to kick them out. How about the SNAP cut or excuse me, the SNAP termination. Any thoughts on what Mirna might be able to do about that, or whether you've ever helped or offered support to someone in your workplace who was facing that? Yep. Contact SNAP, start asking SNAP to explain in writing if they can, why they did this. I see Martha put in the chat, like, attend a hearing. And Kaylin, you typed repeal, which is another fancy word, but you meant appeal, I think, which I love. Two fancy legal words in one idea. And if there's one tip I would want you to leave today with, it's that sort of like the fine print in a lot of the contracts we sign when we download a new app from the App Store on our phone, and maybe we read the license terms really closely and maybe we don't. When someone gets a written decision that's negative, right, about their benefits, about SNAP, about other things, there's often an appeal provision in the small, tiny, fine print. Really important to help people find that and help them preserve their right to appeal. So, true or false in the chat, a landlord cannot retaliate against a tenant for asserting their right to safe housing, even if that tenant does not have legal immigration status. I might have given this away a few moments ago in abundance of enthusiasm. And so I'm glad that we're all on the same page, that this is true, although there may be differences in practice across different parts of our country and even within some regions. How about this? People like Mirna, who experience landlord retaliation for asserting their rights, will have a free attorney appointed to them by the court. True or false? I really look forward to these things. And I want to appreciate Maureen putting a question mark after false. If we were doing these conversations and presentations like this, and every time 100% everybody answered with like certainty, we'd change the question. But the answer is false, and the answer as to why it's false is really complicated. Did I just hear someone come off mute who wants to share? All right, so this varies a lot state by state, but if it's not on this list, it's not guaranteed. We should not rely on law and order, criminal intent, or law and order SVU as the basis for our assumptions about when people in our country get appointed access to lawyers at no cost to them. It is, think in benefits language, right? It's means tested or means based. And the word that's used in the criminal legal system is, can you demonstrate indigency? Talk about a fancy old fashioned word for having a lower income. So this is a big problem, and one that's only gaining more attention now than, frankly, prior decades in our culture. So what do you think? How many low-income households experienced at least one civil legal problem in 2021? Pick your answer from A, B, C, or D, which are progressively increasing. Interesting. People are splitting the difference. The answer is D, which is actually significantly more than C. And you can see also the spread of like volume of legal needs at those levels, number of distinct legal needs. It's a sobering figure. And thank you to the Legal Services Corporation for this data. Okay, how many people who reported having a legal need sought legal assistance? What do you think? A, B, C, or D? Again, progressive. I'm seeing some diversity in people's impressions, more so than the first time, but a little bit more conservative thinking that maybe it's at 13 or 19%. Okay, 19% has it. And in that band, we're talking about, all kinds of law being in play, and more distribution of family and safety legal questions and wills and estates and sort of advanced care planning across the spectrum. Okay, of all the legal problems reported by lower income Americans in 2021, only 7% received any or enough legal help. True or false? I have a feeling I'm preaching to the choir here, but I see that, yes, the trues have it. And that's just, I think, an astonishing figure. And if it isn't an astonishing figure to policymakers who read this, we have to figure out how to get them astonished, because this is profoundly unjust. The ramifications for health, well-being, dignity, and flourishing are widespread. This is an excerpt from the federal Attorney General's office under the Biden administration, acknowledging in very new and important ways that lack of access to legal resources leads to job loss, housing loss, disruption of family stability, consumer protections, and liberty. And against this backdrop, a bunch of us stakeholders, including some people from communities who may be represented on this network call, came together and said, we've got to try to put some thinking down on paper and maybe generate some initial tools that might be useful to connect the dots between legal problem solving and flourishing for perinatal and early childhood systems. And also, start somewhere so that we can pick up the pace of the march toward greater equity and flourishing. So what are we talking about when we talk about legal problem solving as part of family support work? And I do want to just punctuate our understanding that family support work is much broader than home visiting. Home visiting is a really big part of it. And I know we have some amazing home visiting leaders on this call. But I also want to just emphasize how much we appreciate the breadth of family support work framed as such. So, why did we come together? How did we get about, 50 people to come together for 18 months? We all had shared values and beliefs that barriers to legal information and rights enforcement, including in situation like Mirna's when she's contending with unhealthy housing conditions and threatened retaliation, amplify structural inequities that are holding back people, families, and populations, and creating more unnecessary barriers to health, wellness, and flourishing. We are mindful that early childhood-based teams have long been first responders on families' social health needs and goals, and need a bigger toolbox to the extent they feel like they have any toolbox at all. There's a growing evidence base, which is exciting, for the power of legal information and problem solving to advance prevention. And there are actually concrete things systems can do to learn more about people's legal rights and remedies, and to actually integrate that knowledge into how they execute their system work. No surprise, over the course of this 18 months, the biggest theme of our conversation on legal problem and flourishing did not have a legal sheen to it at all. It was about trust building. And it was these 50 people, who are all credited as co-authors and learning community members from across the country, but especially from Orange County, California, from the state of Rhode Island, and from Boston, Massachusetts, who helped suss out that theme of trust building as just as important to legal problem solving and flourishing as it would be to so-called motivational interviewing or strengths-based communication or anything like that. So what did we mean? What do we mean by legal problem solving? We mean something bigger than legal services. We mean something bigger than legal advocacy. And this is a working definition shared in the handbook. And by the way, the link to the handbook is included in a later slide, and we're excited for all of you to get your hands on it digitally and beyond. Just want to highlight for a moment that this definition intentionally references a range of relationships, processes, and collaborations geared to supporting people and communities to secure the resources they seek. And we list 7 different elements or activities that it can encompass, but we know that's not the end of it. And I think it's important to emphasize that the L in MLP is for legal, not lawyer. And lawyers are really, and I'm one of them, these are my people a lot of the time. We're part of the solution, but we're not the whole solution. So we work and work and work on this handbook, and we're going to dive into some details in a few minutes, but I just want to fast forward that by the end of September of last year, we were ready to release publicly this handbook and actually to have members of the learning community from these 3 communities I mentioned really frame it nationally. And I'd like to introduce one of our colleagues, Dunia Belmir, from the Boston, Massachusetts area, and let her, in her own words, tell us all why she decided to join this learning community and why she is committed to the work that the handbook has launched. Is it, Caitlin? I see your.
I don't think we're hearing it.
All
You
right.
might need to stop share and reshare and check that box to share your computer audio.
That is a great idea, and I know myself well enough to know that that will derail things significantly enough that that I am just going to take the liberty, and it is a liberty because Dunia is a wonderful presenter, of just reading for the moment her thoughts. As a child growing up with a family who would have benefited from all these programs, that didn't know how to access them or where. I mean, obviously I was too young, I didn't know any, but I see my struggles, and I don't like to see other people struggle the same way that I did. If I see a clear path, I'm going to help. My father is an immigrant, my husband is an immigrant, so those resonate a lot with me. But also my mother, yeah, she was born here. Yeah, she speaks English as a first language, but growing up getting eviction notices or Social Security for her or food stamp papers, not knowing exactly what these words were or what they meant, but I had to figure it out on my own, or I had to help her figure it out because she didn't know. I would rather have somebody or be that person for families to access this help and to understand what rights they have and what they can do to make their family better and help their children flourish and grow. Thank you, Dunia, and apologies for not being able to elevate your actual voice in this. So what did we focus on in this handbook? We focused on a few core subjects: filling the toolbox. What is this mythical legal problem-solving toolbox that people in the workforce need but don't have? Avoiding the wrong tools, and identifying external assets were 3 critical areas. Just to give you one example, going back to that working definition of legal problem solving, and one element was rights education. One suggestion in the toolkit, or in the handbook, excuse me, in the context of family law, is to actually systematically incorporate basic know your rights information into screening dialogues with families, whether it's screening for concrete supports barriers, screening for health-related social needs, whatever the screening context that you are navigating in your work with families as a care partner, as a direct care partner, or as a system administrator. It is possible to do a lot of really important education with families around their rights through relatively minor adjustments to scripts in screening protocols. And systems, just looking at the right-hand column, can do a lot of things. That these are just a few to support their workforces to be able to do what's described on the left. There are ways illustrated through Dual Say, illustrated through MLPB's work and other settings, to equip teams with continuous legal education that isn't trying to turn them into lawyers, but is making them even more effective problem-solving partners to the people they serve. There's designing meetings, problem-solving meetings across teams that are really healthy and poised to promote even more effective problem solving. And there are options to sponsor Know Your Rights events for one's community, for a systems community, lots of different things. Another element is coaching on system navigation. In this context, in the handbook, we were focused on guardianship challenges and making sure that team members know what are some of the key timelines and deadlines that come up for families when they find themselves in a guardianship context. And, it's one thing to think about this ahead of a minor turning 18. It's another thing to wait till they're 17, because sometimes that can be a little bit too late for things to work out exactly by the 18th birthday. And when a child has a range of complex medical or behavioral health needs, having that locked in by that birthday is really high stakes. And there may even be opportunities, if your system authorizes it, if your organization and supervisor authorizes it, to accompany the family to planning meetings and court hearings. That's not the same as going in a legal representation posture, but it can be very impactful for families to have that support network there. On the system side, helping to define boundaries and lanes, what's in, what's out of bounds for our team to help families with in terms of system navigation. There are wonderful opportunities and really important and urgent opportunities to clarify in job descriptions and workflows. All right, so, our team is not only authorized, but encouraged to go to these kinds of meetings with families. And our team is explicitly advised that they are not to sign any legal documents on behalf of families. I'm just going to pause here in case anybody has questions, comments, or challenges so far. All right. Thank you. So, avoiding the wrong tools. I don't know if this is a familiar saying to anyone, but I think it's a really powerful one. And, we could talk about this in a lot of contexts, like what I said before. If all you have is a lawyer, then everything looks like a legal problem, or like a legal problem that requires legal representation. But in this case, one of the tools that's been in the toolbox of family support systems for a long time, and one that I know sophisticated family support systems have a complicated relationship with, is mandated reporting and relationships with child welfare agencies. And this actually dominated quite a bit of our 18-month dialogue, that in an environment where trust building is paramount in any problem-solving context, and there are so many reasons for many families to distrust people who offer support to them, it's critical to set up these efforts for success to be adopting even more transparency and affirmative communication with families about what a team member or system's role or obligation is in relation to mandated reporting. A lot of, if you spend time on this section in the handbook, you'll see there's a lot of sort of basic background information about, like, what are mandated reporting laws? And oh my goodness, they look really different in a lot of different states. In Rhode Island, every citizen of the state of Rhode Island is a mandated reporter and is subject to a range of penalties up to and including jail time if they are deemed to have not met that obligation. In many other states, it is quite a limited set of people, including clinicians and pediatric clinicians, that are on the hook. So demystifying this is part of a step toward transparency. Transparency, we know, is an important step toward more trusting relationships that can enable more powerful problem-solving tools. Because of what my technical limitations, I'm not going to play or read this insight from Sarah Remington, which she vocalized at the handbook release event on September 29th. But I do just want to emphasize that what Sarah is commenting on is her understanding in her program manager role at the state public health agency that building trust is critically important, that education of staff and families is fundamental, and that these conversations must be strengths-based. And it seems like there's, you know, a lot of wonderful modeling that the early childhood community can do on that. And there also continues to be learning for all of us on what that means and how it relates to transparency. Oh, pardon me. Again, just to make my point, I activated that audio without intending to, and managed to think that one of you was weighing in from the Zoom room. Here we go. So when we talk about avoiding the wrong tools, we talked a lot about something that was a new, juicy, and even scary phrase for many in the learning community. The unauthorized practice of law, or UPL, capital U, capital P, capital L. Again, it's been a particularly closely read section of the handbook. And understanding what it is and what it is from a consumer protection lens is important, and also what it represents in terms of the legal community's interests, just like there have been battles for decades over welcoming midwives and doulas into birthing care at highly professionalized healthcare settings. There are similar innovations and debates happening in the law around who can and cannot do what. And this has got to be front and center for team members, team supervisors, and systems as they think about how they can engage in more legal problem solving with the families they serve while still managing risk. All right, so let's do an easy one. Sorry to say, back to Mirna's hypothetical, that her daughter was kicked out of daycare because she was, quote, crying all day and, quote, disrupting the nap time of the other children. You validate for Mirna that this is common during sickle cell pain episodes. And Mirna obviously tried to, but they were not budging. Mirna tells you that she wants to make a choice not to appeal this because the risk of losing that appeal is too high. She doesn't want to lose her childcare voucher, and whatever's going on in her state and community, she's worried that she will. So question, how can you advocate for Mirna? How can we advocate for Mirna if we're not lawyers representing her in this process? Tell me what you think you can do. Thank you, Jody, for your comment on the disproportionate impact of this kind of adverse childcare decision on families of color. So yeah, tell me what in the chat, what do you think you can do? Not what you can't. Yep, I'm seeing D, that it's just a referral. I'm seeing all but E. I'm seeing some, okay, so good. This is again a good question for the group and for us. Ooh, and guess what? Lauren Carlton, you get the gold star. The only thing here that would be a violation of UPL is E. Now, just to be clear, when we say under A, provide documentation, we're not talking about writing documentation that is outside your scope of clinical knowledge, but really there's a lot that can be done while still staying outside the boundary of a UPL violation. And there's a lot more information in the handbook about how to plan for this. Okay, so expanding the toolbox, thinking about external assets. This is so many things, right? It's collaborating organizations, it's collaborating legal problem solvers who could be many people. They could be community organizers, they could be legal aid agencies, they could be immigrant rights organizations. It's also about moolah, to be blunt. And so just want to spotlight here that one of the tools, and there are many in the toolkit, there are actually 10, one of the tools that we've shared here is a summary of federal sources of support for legal problem solving, which doesn't mean that, Googling all of these is going to lead immediately to the, the bounty of resources that your organization has been looking for a long time to, for example, launch Dulce. However, if we take the really long view, if we were talking 20 years ago, very little of this would exist at all. This might have there might be one entry on this page. Things are shifting. And if you are part of a team, an organization, or a system that is doing creative jigsaw puzzling to figure out resources to make truly human-centered and family-centered work possible, we just want to make sure you have access to some of the most recent information out there about these kinds of pathways. So, in a nutshell, this message is resonating. The idea that legal problem solving is connected fundamentally to health, wellness, and flourishing for families with young children, but also families in planning mode for expanding their families across the lifespan. And we were invited very quickly in the final phase of this learning community experience, and thank you, JPB Foundation, for making this experience possible, to present and engage with a range of stakeholders about our learning, about the handbook, and we're really gratified. So I've talked a lot. You've given me the incredible human chemistry that I was hoping for in the chat. And I also see and can discern, just how much expertise and wisdom is in this Zoom room based on your references to what you've seen and what families you've served have experienced. Next steps. Recommended reading. I want to call out a CSSP publication from 2019 called Legal Partnering for Child and Family Health. And MLPB was privileged to be a part of that publication. It has some early foundational material that you might find helpful as a system builder. We've also got the handbook, and the link is coming up in the next slide. And I'm excited to tell you that very soon the handbook's tools will all be available in, I think, about 4 non-English languages, including Spanish, Vietnamese, Cape Verdean Creole, and one other that I'm forgetting right now. But all languages that were prioritized by our 3 partner communities in Rhode Island, Boston, and Orange County, but certainly have other national application, and I think we're thrilled. So going forward, if you want to get the English version of the full handbook, the link on the left-hand side is active, and soon it will be either on that page or an adjacent page that one can access the tools in those additional languages. If you have feedback for us, we want it, because we know we just covered, in 18 months and 40 pages, scratching the surface of these connections. And how, if you want to talk more about how you as a community of care can think more about this as an element of care, Amy's contact information is there. Some of you may know Jeff Gilbert, our partnership and project manager. And yes, Donna, I see that. I'm going to go back and do that. Oh, thank you so much. Thank you, Jen. And as Kaylin said at the beginning, and as a Dulce co-developer, I'm going to sing this, till the cows come home. You may be familiar with Dulce, you may not, but it is another pathway to bridging legal knowledge and resources in your community. And I really, encourage you to be thinking about that if you're not already. And thank you for talking and thinking about daisies and ZZs and Black-Eyed Susans, and bringing that kind of forward-looking lens to the work that you're doing with families every day. We're really honored to be in this ecosystem with you, and look forward to, thoughts, questions, challenges. I'll stop here.
Thank you so much, Samantha. This has been really helpful. And I was grateful that people were so interactive in the chat. I think others are appreciating the information you're sharing too. So I'm glad somebody found the link and threw it in the chat. You will also, I think you'll have the slides later where those links will be active. But I know it can be frustrating to click on that Zoom screen and nothing happens. I'm going to move us into a few updates from the Alliance and CSSP. And I realize I'm in the wrong mode here. There we go. So I'll hand off to Maureen to share an update from the Alliance, and then I'll share some from CSSB.
Hi, everyone. Maureen Holliker, National Director of Training with the Alliance. I just have one very quick update for you, and that is that, and you can go to the next slide, Kaylin. Our January training of trainers is coming up very quickly here. Thanks, Lucretia, for putting that in the chat box. It is full, but if you or someone you know wants to get in on this training at the beginning of the year, I can let a few more people in. So you can find that information there. Also, Lucretia will put a link to our website where you can find information on upcoming trainings. We will have at least 3 more open training of trainers that will be virtual across the country, and excited to hear that we're getting calls about folks that actually want to have them in person again. So I'm ready to travel. Exciting, even though I have a cold in the beginning of January. So I hope all of you are well. And Samantha, that was fantastic information. So thank you very much.
All right, thanks, Maureen. I'm going to share actually just one big update from the Center for the Study of Social Policy. We released a paper just last week that is about Help Me Grow and Strengthening Families. And so as you might tell from the title, and I just put the link in the chat, this paper is primarily about the alignment between Help Me Grow, their system model, and the Strengthening Families Approach and Protective Factors Framework. We go through a lot of examples of how Help Me Grow affiliates around the country are using Strengthening Families. And so I hope that lots of people will be interested in that paper just because it's about these 2 popular initiatives that many of you are familiar with and using. But this paper also is a little bit of a sneak peek, a Trojan horse, perhaps, that in the context of writing this paper, because we are currently working on refreshing our Strengthening Families content, this paper has some sneak peeks. And so I wanted to run through that for you and encourage you to download the paper and look at it for yourself and get excited about what's coming. So what you see on your screen now is a table that's in the paper that has updated definitions of the protective factors. These are not set in stone. They're published in a PDF on our website, but not set in stone, but this is the direction we're moving. So you can see for each protective factor, an updated definition and some key points. These are kind of getting at sometimes, ways we want to nudge the way we talk about this protective factor a little bit away from how some people have talked about it in the past, or just key points we want to make. So I'm not going to read through these, but you can see them on your screen. We do not have any plan of changing what the 5 protective factors are in the framework. But as you can see, some slight adjustments to how we define them and the talking points that we're going to provide. I apologize, my graphics look a bit wonky here. Cutting and pasting from a document. And so some of it looks different than the rest. But without reading them, I do want to leave it on the screen long enough for you to see what these definitions look like. And also encourage you, the link is in the chat box if you want to download the paper and see it for yourself. And then the 5th protective factor, concrete support, which we've been talking a lot about today, of helping people seek, access, advocate for, and receive their needed supports and services. That's what the legal problem solving is all about. And then I also want to highlight another thing. This is not updated language. This is new, having a set of core values behind the Strengthening Families approach. So you can see those there. Again, I won't read all the definitions, but just quickly say it's about a whole family approach, a strength-based approach, taking a social ecological perspective, a holistic approach, which refers to healing and well-being, having parent voice at the table and as part of all decision-making, cultural humility and cultural competence, and an anti-racism ideology. So none of these should be shocking to those who have been using Strengthening Families, but we haven't articulated them before as a set of core values. Again, they're not set in stone quite yet, but we do reference them in this paper about Help Me Grow because it was in the works and we didn't want to be putting out a paper that compared Help Me Grow to an older version of how we were talking about Strengthening Families. So this is where you can see the sort of sneak peek. And the one additional thing that I'm really excited about in this paper, because I think if you've been in the Strengthening Families world for very long, you have wondered about what you see on the screen right now, which is how is Strengthening Families connected to or different from, or maybe even, you know, in competition with some other initiative or framework? And the answer is there's no competition, but that all of these different strength-based approaches work in similar ways, but depending on who your audience is that you're working with, what context you're engaging with, what age group you're talking to, it might play out differently in one framework or set of tools might be more useful than another, but all of them are contributing to this general pathway where we use strength-based approaches that help parents to be strong and supported. And when parents are strong and supported, we know that they are able to build and sustain nurturing families where we have stronger early relational health, a greater likelihood of positive childhood experiences and a lower likelihood of adverse childhood experiences, and children are more likely to be buffered from stress when it does occur. All of that we know leads to more likelihood of thriving children, whether we think about health and well-being, school readiness, or lowering the risk of abuse and neglect. All of those outcomes come when we step into one of these, you know, along this pathway. We also put all of this in the context of supportive and equitable communities. So those are communities where there's a commitment to making children and families a priority. There are quality services that meet the needs of all children and families. There are neighborhoods where families can thrive and policies that support and are responsive to families. And there are targeted efforts to reduce poverty, advance equity, and improve those social determinants of health. So I put all the words in one graphic for the first time. We did that, my co-author, Charlene Harper Brown, and I, with input from a lot of people who are involved in these other frameworks. And so I hope this will be useful for everyone's work, and hope that we will continue. Well, I know that we will continue to iterate on this graphic. It is in the report that I just put the link in for about Help Me Grow. And as I said, this is in the context of a paper just about Help Me Grow, but it really was an opportune time to make the connection across all these different initiatives, because we didn't want to just talk about these two pieces of it when we know they're all connected. And none of us involved in any of these initiatives have any sense of turf of over the others, but rather we all want to see this way of working with families advance to support children thriving. And this shows how they all fit together. So again, not set in stone. There may be a different version of it as we release other updated materials, but I wanted to give you all a sneak peek. And hopefully it will be helpful to see it all on one page. And with that, we are going to wrap up. We're actually a little ahead of time. So many thanks to Samantha Morton. I saw Samantha had to jump off, but so grateful to have her presenting that work and to share all of that with you. And I hope that you'll join us again next month when, as Maureen said, we will be sharing some exciting new news about early relational health and opportunities to further the work of advancing that thriving through that particular approach of early relational health. So thank you all for joining us. Have a great rest of your day. Stay healthy, and we will talk soon.